What's going on, everyone? It's Alex here from Alex Physio. Today we're going to be going over 5 exercises that you can do after a hip labral tear. Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia, and today we're going to be going over 5 exercises that you can do if you've had a hip labral tear. Just a quick anatomy lesson with regards to the labrum. The labrum is basically a piece of cartilage that envelops your acetabulum, which is the socket component of your hip, that basically helps to increase the surface area between the ball, which is your femoral head, and the acetabulum to allow for more stability, for more static stability, and then you get dynamic stability from your muscles. If you've had a hip labral tear, you can go the conservative route or the surgical route, depending on the type of tear and how severe it is. However, generally we want to try to work on conservative options first, just to see how much recovery we can make and if it is something that can be amenable to conservative treatment versus immediately going the surgical route if possible. First exercise we're going to do standing fire hydrants. So what this is going to look like is I'm going to wrap this mini band right above my knees, and I'm going to try to stand on my left leg, hands on my pelvis, knee bent. If the right hip is my affected hip, I'm just going to try to bring my leg out to the side and come back to the start. Out to the side, back to the start. You should be feeling the side of your hip muscles working as you do this. We get a bang for your buck in 2 ways. So the first way is obviously we're working the leg where you are moving. So in this case, the right leg, we're working those hip muscles, glute muscles. And then we're also working on the left leg. That's going to be our stabilizing leg. So we're working some of the stabilizing muscles in our left leg here. So primarily our glute medius muscle. And again, you're not wanting to go too far in the range of motion with this, just enough that'll allow your hips to go. We're going into hip abduction here. So you don't want to go too high up where you're rotating your torso, just enough where you can feel the muscle working. Hold at the end range. Again, it works your balance a little bit, as you can tell, with me struggling. So obviously this is also a balance exercise as well on the left leg, dynamic balance. So just go as far as you feel comfortable, hold at the end range, and then come back nice and controlled. And then again, you can do it on the other side. You're just getting a different benefit on each leg. One is the active leg, and then the other one is the stabilizing leg. Lean forward slightly, and then try to make it so that the leg is back, so you're in a little bit of hip extension, and then you bring your leg out to the side versus starting here and then going out to the side. So you kind of want to go out to the side and at a diagonal. Okay, so that's exercise 1, the standing fire hydrant with a band. Exercise 2, we're going to do a Stork Stand. So what this is going to look like is we're going to bring our knee against the wall, and the knee on the outside, in this case my left, is going to be slightly bent. Knees are going to be in line with each other. I'm trying to bring my torso as close to the wall as possible without actually touching, and I'm going to lean forward slightly. I'm actively pushing my knee into the wall, and I'm just trying to hold this position. So we should feel that left glute med muscle working, our stabilizer muscle, and then you're working a little bit on the left hip or the right hip muscle here because you're actively pushing your knee into the wall. But again, most of the emphasis is on this left leg here. As I come further, so if I bring my leg further out and I put my knee against the wall, the amount of translation, so how much I'm moving my torso towards the wall, is going to increase how much that left glute muscle has to work. So again, I'm getting as close as possible with my shoulder without actually touching it, leaning forward slightly. I'm just trying to hold this position. You should really feel burn in that outer hip muscle here. So I'm going to try to hold this for about 10 seconds. And relax. So that's exercise 2, our Stork Stand. Some people call it the Captain Morgan. Exercise 3, we're just going to do a forward lunge. So what this is going to look like is I'm stepping forward, I'm bending both my knees, but most of my weight is on my forward knee. I'm going to try to stay a little bit more upright with this one. Bend until the back knee is almost touching the ground. Push off that front leg, and come back to the start. Of course, you can do this with a weight at your chest or at your sides, depending on what stage you are and how provocative the symptoms are. Just starting with body weight is a good starting point. Okay, so stepping forward, bending both knees, looking straight ahead, weight is on that front leg, push off that front leg, come back to the start. You want to try to make sure you're working a little bit on your balance. You're not just stepping, balance, and then kind of going all over the place. Break it down into parts if you feel like you're wobbling too much, just to get a feel for it. Step, plant, control, come down, and then push off. Again, you can break it up into parts. If you find you're too unsteady with that, you can always just start in that split stance position and just go up and down. You can hold on to the wall if you need for balance. Okay, that's exercise 3, forward lunge. Exercise 4, we're going to use this kettlebell. We're going to do a single leg RDL or single leg deadlift. Hand on my right leg, and I'll put the weight on my right leg. And I'm basically trying to bring my torso forward. At the same time, I'm trying to bring my left leg back, nice and balanced, until that kettlebell is almost touching the ground. And then I'm driving up to the start. So in this case, I'm working that right hip muscle, and also working the left glute max muscle, the big one. The big glute muscle, because you're going into hip extension or hip straightening. Working here is our glute muscle, our stabilizer muscles on the side, on the outside, and we're coming up. And as we're coming up, we're squeezing our bum muscles together and then going back again. So as your torso moves forward, your left leg in this case moves back. Try to get your back toes pointing towards your heel, just so you're not twisting your torso too much in your pelvis. So you're trying to keep it relatively neutral with your toe pointing to your right heel in this case, and then back to the start, nice and controlled. Again, if this is challenging from a balance perspective, you can of course do it without the kettlebell, or you can hold on to the wall as you're doing it, just to kind of get used to the motion and the mechanics. Okay, the right knee in this case is just slightly bent as you're going through that movement. Alternatively, you can also try to slide the leg back as you're getting into that pattern, that hip hinge pattern, and then just lift up slightly at the end, and then come back to the start. There's multiple ways to break down this movement, depending on where you're at from a symptom perspective, and also for how challenging the exercise is perspective. That's exercise 4, the single leg deadlift. Exercise 5, we're going to do a single leg glute bridge. So what this is going to look like, we're going to use our left leg in this case. We're going to cross our right leg over our left leg, dig our heel and the bottom of our foot into the ground, and we're trying to squeeze our bum muscles and try to come up as high as you comfortably can, trying to get to a point where your hips are straight. Squeeze your bum muscles, come back to the start. So squeeze bum, drive through, hold, and back to the start. If this is too challenging, you can always start with having 2 feet on the ground just to help work on the mechanics a little bit, or if it's too provocative symptomatically, lifting up, come back down, squeeze, up, come back down. If it's too easy, you can do it with the right leg straight, up, hold, and back down. Having the right leg over the left leg makes it a little bit easier versus not having any support at all. So there you have it. We went over 5 exercises that you can do after a hip labral tear. Obviously, some of these exercises are going to be quite provocative if you have just been diagnosed because of where you are in the recovery. But regardless, these are some of the things that you want to eventually work towards based on how your recovery has been, to try to work on strengthening the muscles around that labrum, particularly your glute muscles, your glute medius, minimus, maximus, to try to help improve that dynamic stability. Have you ever been diagnosed with a hip labral tear? How has your recovery been? What are some exercises that you've done? Have you seen a physio? Did you end up going the surgical route? Let me know your story below if you feel comfortable. If you found value in this video, please consider checking out some of my other videos. I have over 500 videos on various physio, exercise, and medical related topics. If you still find value, please consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. Until then, we'll see you in the next video. Thanks for watching.